Good morning, parents. Happy Wednesday.
Morning.
Good morning. Good morning, all.
Nice to see you all again, another week. And once again, we're going through this workshop. But before we go through this workshop, we have a COVID corner. But first, let's get into these pre-poll questions. Basically, 3 questions on today's topic, which is spending plans and what you know before we get into this topic. While you do that, I'll introduce myself. Hello, my name is Jason Harper. I'm a workshop facilitator from UIC Center for Literacy, Family Support Service, Parent Outreach Office. Now, we offer different workshops, as you know, as family literacy workshops, financial literacy initiative for parent education, employment readiness workshops. You know, we have those other services like adult education and career transition. And then we also have our social service department that help GED students have access to post-secondary help. Then we have the Resource Center for Autism and Developmental Delays. And last but not least, we have AmeriCorps, which I'm a member of. It's our volunteer program where you receive a biweekly stipend and educational award upon completion of the required 1,700 hours. And now we'll just go over some basic Zoom features. I know we didn't meet last week, so maybe, you're having problems with those Zoom features. So I'll just go over them again. So we have the mute button. I want you to see a red slash over that. That means your mic is muted, and I won't hear you speaking during that time. I'll show you how it works now. See that brief moment in time my mic was muted. I actually keep your mics muted so it can flow smooth throughout the workshop unless like a question is actually have like a question of your own or things like that, things to add toward the workshop. Then we have the stop video feature, and what's your red slash over that. I mean, a video is off. And based on like your settings, you have different like setups with this. You got like a picture or like the first letter of your name. You see, I got a J up for Jason, your full name. Just depends on how you have your settings. And also you have the more with those 3 dots. You have that more option, or you have a like virtual reaction button. You can use those virtual reactions freely throughout the workshop. So feel free to do so. You also have the chat box, which you can use freely throughout the workshop as well. And now that that's been covered, I want to introduce my co-host this morning, Mr. Byron. Can I get a good morning from Mr. Byron, please?
Good morning, Mr. Byron.
Good morning. Good morning, all.
Good
Glad you
morning.
can make it. All right.
Thank you all. Appreciate it. And the materials you need are this paper, pencil, or pen. Your preference on the writing utensil, a paper, pencil, or pen. But before we get into this workshop today, once again, we're going over the COVID corner once again. It's a brief go over. It's like 5 to 10 minutes just going over COVID corner. Once again, we're not trying to influence you, saying you should go get the shot or things like that. Just keep you informed on where you can get the shot and what's the steps to take on getting that vaccine shot. And so this is being brought to you by these family support partners. You can see Chicago Early Learning, Center for Literacy, and you can go into the next slide. The UIC Center for Literacy is part of the Protect Chicago Partnership, which has provided funding to promote vaccine awareness to Chicago families. And our goals with this COVID corner is to first share facts about the importance of the vaccine and also share resources for Chicago residents on how to get a COVID-19 vaccine. And so the question is being asked, who's getting the vaccine and why? As you know, I went over this last time, the Obama family is getting it. And so we see during this time, Barack was talking about Michelle, and he got vaccinated, and he went over the reasons why. As he want, the best way to beat this pandemic is to protect one another and get the country back up and running again. So he wrote alongside the video clip, so I hope you'll get the vaccine as soon as it's available to you. And it says in the bottom, you can see these little tips. That's red. That's not a red right here. It's little tips. African Americans are 3 times more likely to have COVID-19 complications. Once again, we're not forcing no one to get the vaccine. I'm saying you should just go out there and get it, but you just give you awareness because numbers are up with the African American community. Now we're going to our next slide, which is a Chicago resident. Picture right here is a Humboldt Park resident. And you see it goes into detail about how Latinos across the city of Chicago have the highest rate of infections compared with all the other different demographics, with a daily positive rate of 13.5%, according to city data. That's more than double the citywide rate of 5.6%. So once again, it's informing you, giving you those numbers and those details. Anything in red is like those tips, but you also take note of that as well. This is posted by the Chicago Sun-Times. And then last but not least, we have Chicago Mayor Lori Lightfoot. She also got the vaccine. She rolled up her sleeve and got the COVID-19 vaccine at St. Bernard Hospital as the city officially moved into phase 1B of the vaccine distribution plan. The Chicago Department of Public Health Commissioner Dr. Allison Arwitty administered the vaccine to Mayor Lightfoot. So these are some people that are getting the vaccine that we know these figures, or just residents of a certain neighborhood that's getting the vaccine. So just keep you all aware of what's going on in the neighborhoods and how the numbers are looking. You go to the next slide. And so why should I consider getting the vaccine? These are some reasons why you should consider getting it. So getting the COVID-19 vaccine helps prevent you from getting sick with COVID-19. See, it gives you 3 areas. Focus on it helps you, even if you're young, healthy people, COVID-19 can cause very serious illness and death. Older people and persons with health conditions like diabetes are at an even greater risk. So if you know somebody like that, it also says in that following box to help your family, friends, or community, if you're struggling with certain complications, things like that, and you want to keep yourself aware or away from the, getting no further the implicated with those complications, you probably want to get the vaccine. Once again, we're not forcing no one, just keep you all informed though about it. And so we see that the more people who get the vaccine, the better. We can protect our family and community and ensure people can go back to their jobs. So that's another reason why you should possibly consider getting it, and also to move forward together. We know the best way to achieve normalcy is for all of us to get vaccinated for the coronavirus so we can collectively end this pandemic and provide justice to communities that have been especially impacted. So those are just a couple of reasons why you should consider getting it. We're not forcing no one to get it once again. And so the question has been arise, can I get a vaccine? And so yes, officially we enter 1C at March 29th, and that means essential workers in Chicago in 16 to 64 with underlying conditions are able to get the vaccine now. And as you see, if you read that lower boxes, it's kind of low, but I'll read it. Vaccine supply is still limited. Most will be vaccinated in April and May. Oh, Mr. Vita raised her hand. Okay, you have a question? Go ahead.
Yeah, I had a quick question. With them pausing I know the Johnson & Johnson was just paused for some reason. So do you think it's still okay to get the vaccination? I know they were saying Moderna and Pfizer was the best. I'm just asking because I haven't really considering it, but I just really want to know, since you're doing the COVID corner, what's your thought on actually doing it, and have you gotten it?
Me, no, I have not personally gotten it. It's all a personal choice for each one of us. I would not, I'm not trying to say go out there and get it, but we just keeping everybody informed. And I'm glad you asked this question on this slide, because right here we have the UIC COVID-19 helpline. So if you have any questions, you want to know more about certain things, this is where you can get that certain information. Because I'm not too well versed on this COVID-19, how it is currently going with the vaccines, but this is what you can call. So you could call the UIC COVID-19 helpline. It began April 13th, 2021. And it's the number right here below, 773-645-0558. Once again, that's 773-645-0558. So you have any questions about how the vaccine is going, how it's looking, you can call that helpline. They can help you right away, because actually I'm not too well versed on it. So I'll just give you my personal opinion on why or what I think. But when we you go ahead, Byron.
And just to, not to interrupt, but I am of the COVID-19 help hotline. So the hours of operation for the UIC COVID help hotline are from Tuesday through Thursday from 10 a.m. to 12 noon. And we're open from 3 p.m. to 5 p.m. So basically, you can call that hotline, and myself, and the other agents will help you out with information about tips on where to get vaccinated at, tips on frequent asked questions about all the vaccines that are out right now. Again, as stated in the news, they did pause the J&J vaccination. So we can ask your questions on that UIC COVID help hotline. So don't hesitate to give us a call on that, and we can answer all those questions during that time.
And they have resumed the J&J.
They have. Yes, they have. Yep.
Okay, I don't watch the news often. I'm just the news depresses me, so I haven't been watching it, but I hear it in an email or something. So I was just asking. Really?
Oh yeah, thank you for asking. Yeah, it helped go into the COVID-19 helpline. So the question may be arise, how do I get an appointment? So let's go through how you can get an appointment. And so how to get vaccinated. So we have the 4 best options that you probably want to go this route. Your first option is your healthcare provider. Your first contact should be a healthcare provider, including your primary care provider, your health clinic, or a hospital where you have gotten medical care in the past. Over 350 healthcare providers have signed up with CDPH to distribute vaccines. Providers are also reaching out directly to schedule appointments with their existing patients, prioritizing those who are older with more underlying health conditions. Healthcare providers can still sign up to be vaccine providers. So that's one route you can take, or you can go to your pharmacy. We see the city of Chicago has provided vaccines to pharmacies across Chicago. These pharmacies each have their own registration link, which can be found below. So you have Walgreens, Mariano's, Walmart, Jewel-Osco, Chicago Costco Pharmacies, and Lincoln Park, Chicago Costco Pharmacies, and Chicago, Illinois Medical District. The city of Chicago does not endorse any of these listed organizations. So these are some pharmacies you can go to throughout Chicago. So I'll give you time to take that in before we go into option 3 and 4. Okay, we can go on to option 3 and 4. And so now we see your employer, specific employers prioritize essential worker groups, which will be able to distribute the COVID-19 vaccine to their employees. And 1B, CDPH is working directly with employers as vaccine becomes available. For example, first responders are already being vaccinated and others will begin soon. If you will receive your vaccine through your employer, you do not need to take any other action. So your employer is another option. And then you have ZocDoc. If you have insurance but do not have a primary care provider, please check with your insurance company for a list of providers accepting new patients. If you do not have insurance, one option is to enroll with one of Chicago's many federally qualified health centers, FQHCs. Download FQHC flyers in English and Spanish. So we have ZocDoc, we have your employer, we have the pharmacies and your healthcare provider. These are 4 options you can use. And once again, you see that helpline. If you want to know further information on any of these options, call the helpline. It was just put in the chat. That's 773-645-0558. And we go on to the next slide. And then you can visit this site to sign up for a vaccine. So this is the site you're going to, cookcountypublichealth.org. See all those slashes, communicable diseases, COVID-19 vaccine to register. And here's what you will see when you get there. So you can click the yellow vaccine registration box. Getting vaccinated is the best way to keep yourself and your loved ones healthy. That vaccine registration box right there, and then it'll take you into this following screen. And this is what you should see. Click here to sign up, and then it'll give you the option to sign up if you haven't already, or if you already signed up but you didn't finish your registration, then you can click the I've signed up, and it'll take you right to where you left off. And then from there, this is how it'll look. So you enter your Cook County home or work zip code. You put that below it, then they give you list off that basic information in your sign up form. First and last name, address, city, state, zip code, country, things of that nature. Then the following information. And let me know if I'm going too fast on this as well. Email, phone, date of birth, your gender identity, race, ethnicity. And then from that point on, you put that information in. Then it'll go into like some of the job listing you do, healthcare, a home healthcare worker. If you're a nurse, home resident and staff, you're a frontline essential worker, non-frontline essential worker, or you're 65 plus. Basically trying to see like what's like what you're ranking at, like in terms of like your importance to get the vaccine. They doing older people first, or people that's on the front line, those essential workers, things of that nature. Or do you have underlying medical conditions? Yes, no. How maybe contact you, email, phone, both. And once you complete that, you'll click that red next button. And once you complete that, then they give you the review option. Make sure all your information is correct, because that could mess up your registration if it's not. So that give you that review option. After you finish the review option, go on to the following slide, and this is how to look. You press the submit button at the bottom, and then you're good to go. That registration. And so if you need more help, once again, we encourage you to use that helpline. The assistance is available in English and Spanish. You can also leave a message and we will call you back if we miss your call. As you heard Byron say, it's Tuesday and Thursday. I believe it's Wednesday as well on here, unless some change. Byron, there's some change with that. Is it not Wednesday no more?
Tuesday through Thursday.
Okay, Tuesday through Thursday. Okay, yep. 10 a.m. to 12 p.m. And then we have 3 p.m. to 5. So you can call the helpline. Once again, that number is in the chat. It's going on until June 30th. It started April 13th, but it's going on to June 30th, 2021. So keep that in mind. And you go into the following slide. Let me know if you all need to see this for an extra second or so. Okay. And thank you for joining our workshop. This was our COVID corner. And now we'll get into our workshop for today, which is spending plans. Everybody finished pre-polls, correct?
Yes, sir. Give me 1 second.
Okay. So now we're getting into spending plans. This is our workshop for the day. And the objectives or goals with this workshop. We want to review the concept of needs versus wants, understand the difference between fixed and flexible expenses, identify occasional expenses that do not occur monthly. Last but not least, review how to create spending plans from tracked expenses. So before we complete these goals or objectives, I have a question for you all, and this is our icebreaker for today. 2 questions, actually. So I want you all to think back over the last week and tell me something you bought or paid for that was a need. You put up the next question too. And what did you buy or pay for that was a want? Go right ahead. Open discussion.
Milk, bread is what I needed. What I wanted, canned.
Eat it, and for what I wanted, I bought me a bottle of wine. But it's so good. I think I might have needed that too. But no, seriously, I bought gas, but it's this blueberry Moscato by Oliver's. Oh my gosh, it is so good. I found it at Sam's and it was like a hidden jewel. Oh, it's like probably my favorite.
Thank you for sharing that. Anyone else want to tell some needs and some wants that they bought this week? And why we covered these questions is because we think about these needs versus wants that can affect our spending, right? And our planning on spending, because most needs are like things that we spend like every week or every month on certain purchases and things like that. But once it come on, like it be just a feeling like, okay, I need this. Like you said, you needed that. Like it felt like a need in a moment, or the more like what you wanted in a moment and things like that. So when we focus on these things, we have to ask ourselves these questions: what is a fixed expense and what is a flexible expense? Which is our next question. What do you all think a fixed expense is, and what do you all think a flexible expense is?
Okay, so I'm gonna be honest. So I save so much. I save a certain amount of money, and I don't go in it. So that's my fix. My flexible is whatever I got in that checkings account. If I don't go over that checkings account, we done. That's my play money. We done. Done. I'm done.
Okay. Anyone else want to share what they believe a fixed expense and a flexible expense is?
I think a fixed expense is a certain amount of money, like Lazita said, that you know that you can't touch or you need it for a certain thing or whatever. And
a flexible expense.
What was the other one?
Flexible expense.
And a flexible expense is funds that you know that you can like
do whatever.
What you want, right? Do whatever you want to do with.
Okay, you all have some good ideas. So let's get into the definition of what a fixed expense is. What is a flexible expense? So you see, a fixed expense is an expense that is the same amount from month to month. The expense is controlled by another entity, like a source, like the bills you have every month. This is a fixed expense because it's something that you plan to spend every month. You know the exact amount is going to be every month. But let's go into a flexible expense. A flexible expense are expenses that vary from month to month, depending on how much of something you buy or how much you spend. It's an expense that can change and is controlled by us. And so we see this is more of things that vary from month to month, like certain things we don't have to purchase, like an emergency or things like that, vary from month to month, or some things we want to buy. It's more of like a want than a need. And like with these things and with spending plans, it can affect how we spend if we changing our fixed expenses every month, or if we like changing our flexible expenses every month. And so with this following box, we're going to go into some fixed and some flexible expenses to give you all further detail on what this could be. And so these are some are fixed and flexible. We'll classify them in the next slide. But for now, what do you all think some of the fixed expenses are in this box? What could be some fixed expenses?
Your rent, your mortgage,
housing,
Yep.
food, utilities, and education. Those are fixed because, what is lottery and gambling? Hold on. So wait, quick question. These are like different boxes. They not like going down and then this is what you're using the money for. It's just different boxes, right?
is different boxes of fixed and flexible expenses. They not separated yet.
Okay, yeah. So yeah, I'm gonna go with housing, food, utilities, education, debts and fees. I have to do laundry and household supplies for me. Oh, and savings. I'm big on saving.
Okay. You guys pick some good ones for the fixed expenses. Does anyone see any flexible expenses in these boxes?
Your utilities, household supplies,
Lottery.
Lottery.
that's true, lottery. Clothing.
Giving, contributing gifts,
Yeah.
TV, internet, because I might.
Alcohol.
Yes, you all have some great ideas. And let's go into the next slide to see what are some of the fixed and flexible expenses. And some may even be considered as both as well. And these are some of the lists of fixed and flexible expenses. And these are something, the flexible ones, we control our spending. Like if we want to get like a certain amount on a gift, we have like somebody, birthday is coming up and things like that. We want to get a gift for them, or grooming products, clothing, recreation, entertainment. Household supplies, you all listed some of these, gambling, things like that. Medical expenses are like some of those emergencies that come up that's unexpected. These are flexible expenses. Fixed is more like we have month to month. Utilities is a fixed expense. Housing, insurance, whether it's auto or homeowners or renters. TV, internet are some fixed expenses that we have, every month. Even if, phone bill can be considered like a fixed expense. We can see both as well. It could be a flexible expense depending on your plan as well. So we have phone, debt and fees for both, savings for both, transportation, childcare, education, and food. Why do we believe some of these options that we have in both can be both? Like the phone, why do we think sometimes it's both?
Because you cannot pay that if you just feel like you don't want to pay a cell phone bill. I don't want y'all calling me on my cell phone. Call that house phone.
Anyone else want to share? Thank you for sharing.
Because your bills fluctuate depending on, especially the light bills, it fluctuate depending on the usage.
Yes. We can oftentimes find ourselves, overspending as well when we have, some of that leftover, cash that we have from paychecks and things like that. We find ourselves overspending on some of these both options. Like maybe we overspend on food sometimes. We think we get enough for a week, but it's enough for like 2-3. Or we think we get enough for 2-3 weeks, but it's enough for like a week. Or we overspend on education, or we overspending on or we're not saving enough, or our phone bill. We can go for the cheapest plan, but we go for the highest one, for that new phone, we stand in line and things like that. So this is sometimes why it can be both, because we control it, but sometimes we overspend because it becomes so flexible to us. And so this is some of the boxes. You all can write this down if you want to as well. Give you all time before we move on to the next slide. And when we're doing this, when we're looking at these fixed and flexible expenses, we have to question ourselves on certain of these topics, right? And so let's go on to the next slide and look at some of these questions. Do all your expenses happen every month? So every expense we have, do it happen every month?
Yeah.
Mostly, yeah.
Okay, anyone else?
No, not for me. So like with my hair stuff, like sometimes I just do that like every couple of months. And with like the plates and household stuff, I try to alternate it where it don't come out like every month. So like I buy so much of it in like 1 month where it'll last, like bleach soap powder, it should last me 3 months. And then I'll be like, okay, now it's time to buy it again. I like only thing that I know for definitely come out every month is my car note and my rent. And so those like are definitely set amounts that come out every month. But like with paper supplies and food supplies, that varies because it depends on like how much we ate, how much we at home, like the same with utilities.
Yeah, so it can vary, right, from every month, depending on what we got going on at the time. And so, what are some things that only come up once a year or a few times a year? Anybody think of any expense that come up like once a year or a few times a year?
My taxes.
And the tax. Okay. Anything else? Anyone else care to share?
Oh, and insurance if you pay about a year. There's a lot of people pay as year end.
Yes, it could vary from insurance to those gifts for people, birthdays, anniversaries, things of that nature. You all listed some great options. And so how do we prepare for expenses, that are coming up? How do we prepare for those usually? We know somebody's, anniversary coming up and things like that. How do we prepare for that?
I save. So I'm good at like I have always been like this. So like to be more responsible, I just kind of like make a list in my head of like everything I gotta do and go ahead and put like as soon as I get paid so I can know like exactly how much I got saved over and what I want. And then I kind of like try to know like in my mind what it is I want to spend, like how those numbers are already planned out, like my paycheck number, bill number, so I can know exactly what it is to spend.
Okay, great. Yeah, so we're prepared for it by knowing what to spend and things like that, saving and knowing those dates, keeping those dates in the calendar and things of that nature. And so the final question is, how do you prepare for unexpected expenses, such as repairs and other emergencies?
I hit the save.
Yeah, save again, savings.
Yeah.
Yeah, save is a big part of it.
Yeah, I got so for me, what I've been doing, and it's really, really worked, I got a couple of different accounts for like different things. So this could pay for this, and this could pay for this, and this could pay for that. So it kind of works. And then the hidden money you don't like touch. Like I got a change that I make sure I add to. I got some dollars that I make sure I just save. So like having multiple sources of savings is what I do.
Yeah, it sounds great and kind of like a great plan. Anyone else have a different plan or something they do differently?
I mean, no, I don't. Just in case somebody out there listening, it might think
No, right. Well, let's go
I'm
into
rarely
the.
prepared. I'm
Oh, go
sorry,
ahead.
I just
Oh, go
came
ahead.
back. I'm rarely prepared for unexpected expenses and emergencies, but for some way I get it done. I don't know. It just happens.
Yeah, so some of us are like really prepared for it, or some of us,
I just don't know how.
Oh, okay. Thank you for sharing. Yeah, so some of us are like really prepared for it. Some of us are like not as prepared for it, but somehow we find a way to get it done. So what we're gonna do now is go into the sheet. And it is occasional expenses for the year. It's to help you track your expenses. Examples of holidays, school expenses, clothing for work, replace appliances, car license plate, union dues, car insurance, dentist, family trips, oil change. Tax preparation and pet expenses are some examples of what could be listed here. And so what you're going to do is you're going to list off, because we have to have a plan, right? This spending plans, we're going to list off from month to month, January all the way to December. And we're going to divide by 12 at the end of, after we account all our expenses, divide by 12 and find out the amount to save per month. And so you all could take time to write this down, or you could take a screenshot of, you have to, things of that nature. I'm going to give you a couple minutes to write this down if you want to, list this box on your own paper and pencil or pen, or, if you want to take a screenshot, you can as well. Give you all a couple minutes to do so.
I know this don't got nothing to do, but Bank of America do this. They do this little spreadsheet every month for they clients on like what you spend what on. So they tell you like that probably wasn't in your budget. Like it breaks it down. Like if you spend your card on fast food, gas, or whatever, it lets you know exactly what you spending on, like ATM withdrawals. And so that's a good thing, a good tool to have as well.
Yes, as we went over in one, I think our past workshops we did about saving and things like that, they give you those apps as well that could do the same thing that we're doing today. And so if you all have those other avenues you want to use, you can use those as well. This is just something you can use, like if you keep it on the refrigerator, just remind it every day, like, oh, I got this coming up, or I got this coming up. You have that amount to save every month. So just a visual image that you can see, without hopping on the technology or something like that. So you have those different options as well. Feel free to use any option. Just give you this one, for like memory if you want to use it, things of that nature. Give you all about 2 more minutes. I know it's a lot to write down. You all have about 1 more minute. Let me know if you need some extra time. Be wrapping up your occasional expenses sheet.
Lil Vivi, what you doing for your birthday? I'm sorry, never mind. I thought y'all was still writing.
Let's hold that to the after I reached out, please. Thank you. Okay, the time now 11:38. Let me know if you need a little bit more time. Anybody need a little bit more time? Okay, great. And so what we're going to do, we're going to use this sheet, and we're going to combine it with the other sheet that is on the next slide. So you're going to the next slide, which is spending plans. And so once we have those occasional expenses in our minds, we want to go into this monthly spending plan. And so what we're going to do is we have these categories. We're going to list off categories. Now, this is just an example sheet. Yours can look a little different. Like you're spending, because you know what you're spending on. So if you're spending on saving, housing, utilities, phone, internet, you just list it off. This is just an example sheet. Once again, you all can screenshot this if you want to, or you can write it down, give you some more time to write these things down and things like that. So once again, Lana, once you go through that, you're going to go through your track spending for month 1. And then you're going to go through your plan spending for month 2. So what you'll do is your track is spending for month 1. You write down all your purchases and things like that. And at the bottom, you see that total spending. You're going to put what you spent, and then you're going to put your plan spending for month 2. So how much you want to save, because we know we're trying to do a monthly spending plan. So we're doing like a 2-month difference, a little bit, to see if we can save from month 1 to month 2. So after you do that plan spending for month 2, put that amount at the bottom, you'll go on to track spending for month 2. So you'll compare it to your plan spending, and then you'll know the differences. And you can also note like things you need to write down. Like maybe I could spend $15 less here. And then so that's what the differences in notes form is for as well on the other side. So after we track the spending, plan the spending, and we track again, we find out those differences, we take notes. And then we see on the following side, it has the category. And this is where you put your wages or those expenses, whether you're getting like unemployment or whether, you're getting Social Security or you're getting child support payments, assistance. You put all your total income right here. And then you minus by the total spending you're doing every month. And then you'll know your amount saved or what you overspent. And where did the extra money come from if you did save and things like that. And so once again, you do it on this, you do track spending for month 1, and you plan spending for month 2, then you do track spending again, and you put those differences and notes down. I know this is a lot to take in. Just take your time. Let me know if you have any questions. And as you see at the top, before we even reach that, you have to put down your SMART goal. Anybody remember what these SMART goals are? Anybody remember the SMART goals?
No, can you go over it again? Repeat it.
But I remember what the SMART goals are.
Yeah, the SMART goals are an acronym for specific, measurable,
I did not remember them either. If I actually,
agreed
I know
upon.
that. Yep, agreed upon.
Reasonable and timely.
Timely, yep.
So basically, it's just an acronym just to put your goals down, and each acronym is breaking it down. So how do you breaking down your goals? So make sure it's specific, measurable, attainable, realistic, and timely.
Yes, thank you, Bobby, for the assist. Yes, these SMART goals have to be realistic to you, and some like you have to be like, because we know if we just go out for a plan and we don't have like a goal in mind or something, we're gonna probably give up on that after like a week or two because we don't have a plan with it, we don't have a goal. And so by this, you put your SMART goal down, you put how much you want to save, a realistic goal, of course, but how much you want to save, and that can get it done for you. Does anyone need more time to look at the previous sheet? If not, then we'll go into the spending plan checklist. Okay, great. Let's get into the spending plan checklist. So this is just to double check your spending plan and make sure it's accurate for you and make sure you didn't miss a step. So my plan is for whether it's 1 week, whether it's one pay period, whether it's 1 month, then you write your SMART goal down for your spending plan. This helps you keep your budget in line with your goals. So once again, it's realistic to you. It's a plan just for you. Your SMART goal probably won't look like, your next door neighbors or your friends. It'll be just set for you. And so then you want to subtract your total expenses from the total income. Ask yourself these questions. Are your expenses less than your income? You should have money left over. If not, maybe you missed some expenses. Are your expenses more than your income? Look for expenses you can cut. And so once again, the spending plan checklist is, look for those expenses you can cut, double check with yourself. Does your spending match your goals? Do you want to make that plan for next month? And you want to decide how much you will spend in each category. Leave some wiggle room to handle surprises, because once again, we talked about those occasional expenses or those surprise expenses that come on, to us every so often. So you want to leave some wiggle room. Then you want to decide whether to put some money into savings. You want to know what expenses will you have next month that you didn't have this month. Think about the things you listed on your occasional expenses worksheet. And so that's why they work hand in hand together. And so what will happen if you do not set aside money for these expenses? That's the question you want to ask yourself. What will happen if you do not set money aside for these expenses? And then you want to see will your flexible expenses change? Will utility bills be higher or lower based on the seasons? Because we know it goes up sometimes when it's cold, and things like that, or when it's hot and things like that. It changes, from season. And will your kids need new shoes, or do you want to reduce expenses? Which ones? How much do you think you can cut back next month? And so these are questions you just want to ask yourself. That's why this plan and checklist is here for us to double check what we're doing. You want to check your expenses again for next month and compare them with your plan to see how you did. If you overspent, did you take money from savings or use credit cards to cover the extra expenses? If you spend less than planned, you should have been able to save money. Did you put the money in an envelope or a savings account or use it to pay down debt? Make a new plan for the next month using the same process you followed the first time you track expenses. We know everybody, don't get it down the first try. Do not feel discouraged. Just make a plan. Once again, learn from the mistakes you had in your past spending plans. Go from there and then use this checklist again, to double check what you're doing. And so this is the spending plan checks. I'm going to give you a little bit more time to look over it. If you want to write some down, screenshot it, you can, before we go on to our next slide. Does anyone have any questions on this checklist? Okay, now we go on to the next slide. Okay, so does anyone have any questions on today's workshop? I know we covered a lot of information, a lot of these worksheets that we're doing.
No, I just think the workshop was very helpful. Because me, like I said, I don't have a emergency plan. It's just things to happen for me. I know I need to start making better choices.
Yeah, well, this is a good way to start. These spending plans for us, it helps us look at it as a bigger picture, see it from month to month, rather than just, week to week, where it's just hitting us, on impact. We can look at it in this plan. It's like we can see it early. So we can see like the punch coming before it hits us, kind of in a sense. And so if anyone has any further questions, we have the post-poll questions up. These are 5 questions based on today's workshop. Then you have an extra question for the COVID Corner workshop, whether you felt it was beneficial or not. And once you all complete that, you all are free to go. My name is Jason Hartman, workshop facilitator from UIC Center for Literacy, Family Support Service, Parent Outreach Office, and it's for spending plans. And I get a shout out to my co-host Byron as well.
Thank you guys for attending. I appreciate you. Your participation is greatly appreciated. And again, but just to chime in, you could have been anywhere. I want to quote one of my favorite artists, you could have been anywhere in the world, but you're here with us, and we appreciate that. And we really do. And I want to wish Miss Levita a happy birthday, and look forward to seeing you in the future. And Miss McKinney, I will send that email out that you need those bags by that time, and we will get those to you.
Thank you, Byron.
You're welcome.
And text my phone. I'm having something, but it's invitation only, so you gotta have a text.
Okay.
Okay.
I know it sounds petty, but
it's not. It's not. I know.
All right. Have a good day, y'all.
You as well.
You as well, Miss
Thank you all for attending.
You're quiet.
All right, I think everybody has answered the poll, and that completes the workshop.
Look, why am I the only one?